I'd like to welcome all the therapists and athletic trainers to this talk, and this talk is about complementing any of your protocols for hand, wrist, forearm, and elbow injuries with Handmaster Plus. Everything we do with this product, we've worked with therapy companies for about 7 years now, all the therapy distributors. We've worked with hand therapists, physiotherapists, chiropractors, athletic trainers for about 7 years now. And I want to talk to you a little bit about where we feel that Handmaster Plus fits in your rehabilitation product. First thing I'd like to tell you is that you don't have to change any protocol. The protocols, whatever you do, as far as manual adjusting, as far as using modalities, everything stays the same. And we've worked with a lot of therapists, and that's what the therapists like, is that there really isn't anything that we're telling you to do. We want to be the final stage of your treatment. Once that patient is starting to come around, starting to see some stability, we are looking to use our product to rehabilitate, rebalance, revitalize the area. Most of you will know about Handmaster Plus, and for those that don't, very simply what it does, it strengthens all the muscles that close the hand, but the key part is also strengthens all the muscles that open the hand. And beyond that, you can see that the Handmaster Plus will allow your patient to move in any direction that you choose them to move, and it will follow with resistance. So no matter what the condition you're following, it's very easy to provide resistance for whatever action you're trying to strengthen in them. The main exercise that we are known for, or that we really feel add value to your patients, is, I'm going to bring a soft version out right here. The soft one, very, very uninvasive, so your patients, once they can do actions without resistance, you can start to put a little bit of resistance on, and that is the product with the purple ball and the yellow cords. So the simple exercise is just to have them, is to rebalance the flexor muscles with the extensor muscles, and to also stimulate maximum blood flow and lymph drainage. So in that situation, we want them to go through their full range of motion. So we have the patients keep their wrists straight, keep their elbows supported, and just squeeze against the ball, open and spread against the cord. Squeeze against the ball for one, open against the cord for one. Squeeze, open, spread. When we do this, we start to not only build maximum blood flow and lymph drainage, but we also start to build some tone on the flexor muscles and on the extensor muscles. Okay, so very easy, your protocol, this is the last stage of protocol, and now we have them just go through this, stimulate blood flow, start to make sure the body is stimulated maximally to start to reheal those tissues, and so they strengthen strong. What we found when we add Handmaster Plus to the protocols, to the treatment protocols, and this can be for hand, finger, thumb, hand, wrist, forearm, elbow conditions. But what we find is that we see better outcomes. We see less of these conditions come back, and we find a lot more patient satisfaction. But to explain the basic exercise the patient needs to know, they have to memorize, hey, close the hand against the ball, open and spread against the cord. Close against the ball, open and spread against the cord. This is something that they can do at home. It doesn't interrupt your office protocol at all. It is a take-home situation, so it's an outpatient treatment. So again, the soft one is very uninvasive, starts to stimulate blood flow, starts to rebalance those muscles, and allow them to heal properly. That can be, we use it in many situations, finger, thumb, palmar problems, also carpal tunnel problems, post-surgery. We have patients use this a lot because, again, very uninvasive, very easy to understand, and the patients will comply with this. We don't give them 3 or 4 exercises. Okay, they have to just remember to close, open and spread, close, open and spread. Of course, as you get to know the product better, you can do many, many, many applications. You can even take the cord out of the ball and have them really isolate any area that you want to isolate. It allows them to move naturally through 3 dimensions with resistance, so it's going to stimulate a maximum blood flow, maximum lymph drainage, and it's going to complement your protocol. That's the soft one. We start them off with that, and as you want to move on with your rehabilitation product, we would move them up to the different stages. We'd go from soft, and once you feel they're ready for it, they can go to the medium product. And again, this is a take-home exercises, outpatient treatment, and it's that nice end end treatment to your office protocol. I think you'll really enjoy it. When we see any kind of imbalances, that has to be cleared up for the elbows to get better, whether it's a tennis elbow or a golfer's elbow or tennis elbow, whether it's any kind of forearm problem, where it's a palmar fascia problem, carpal tunnel, thumb problem. We do a lot of work with DeQuervains after your, again, an end-stage protocol for DeQuervains. Any kind of finger dislocations, finger sprains, fractures, things like that. And also we use it after post-surgery. But again, start your patient with the soft, easy exercises to memorize, very easy for them to take home. They won't be confused with it. And then if they choose to, move them up to the medium, and you'll find that to be a really nice end-stage protocol.